It might surprise you, but frequently eating the wrong kinds of nuts can increase your risk of cardiovascular disease by as much as 48%, especially if you're a senior citizen. There's logic to that figure based on research published in the Journal of the American College of Cardiology conducted over several years. The scary part. Some common nuts found in kitchen cabinets can quietly raise blood pressure, cause inflammation, block arteries, and even worsen cognitive decline. Yet many seniors eat them thinking they're healthy. One specific nut, which we'll identify later, has been linked to high concentrations of a toxic substance that with regular consumption can harm your liver, kidneys, and cognitive functions. You probably already have this nut in your snack jar, the same one often touted by low-carb dieters, but it may be causing permanent damage to aging bodies. But don't worry, we've got you covered in this video. Here you'll find the most comprehensive guide to nut consumption, including which ones are safest, best for your heart, and most beneficial for your brain, as well as which ones you should avoid at all costs. Also, make sure to watch until the end, because there's a dark truth about the #1 most dangerous nut that very few people discuss, and it could be significantly harming your health without your knowledge. Please like this video and subscribe to our channel for more content like this before we begin. Also, tell us in the comments where you're watching from. So without further ado, here are the 4 types of nuts that seniors should be eating. Fourth, almonds, the bone-strengthening powerhouse. One of the best foods for an aging body is the almond, thanks to its high calcium and vitamin E content, which together help keep bones strong. Fractures are more likely to cause serious complications as we age, since our bones are naturally more porous and brittle. Natural bone loss accelerates after age 65, but eating just 1/4 cup of almonds per day can help slow it down by providing approximately 97 milligrams of calcium. Not only are almonds rich in calcium, but they also contain magnesium, a mineral that many elderly individuals lack. This is what makes almonds so unique. Magnesium acts as a transporter, preventing calcium from damaging your arteries and instead allowing it to reach your bones. Almonds' beneficial monounsaturated fats also support heart health by lowering levels of bad LDL cholesterol, which is crucial as the risk of cardiovascular disease increases with age. A daily serving of 15 to 20 almonds, ideally raw or dry roasted without salt, is my recommendation for seniors. Almonds are also a great weapon against constipation due to their high fiber content, approximately 3.5 grams per serving, which affects roughly 40% of the elderly population. Above all else, studies conducted by researchers at Tufts University have shown that almonds can help prevent the oxidative damage that many worry will happen to their brain cells as they age. Look for almonds with their skins on, as the flavonoids in the skin combined with vitamin E make the almonds twice as powerful an antioxidant. Warning: almonds can be a choking hazard for elderly people who have trouble swallowing, so be sure to chew them thoroughly before eating. Third, walnuts, the nut that improves cognitive function. Because of their striking resemblance to the brain, the organ they serve to nourish, walnuts stand out as one of the best brain foods for seniors. These extraordinary nuts are the best source of the plant-based omega-3 fatty acid alpha-linolenic acid compared to any other popular nut. This is very significant for the brains of the elderly, since omega-3s aid in neurotransmission and keep the membranes of brain cells intact. Significant gains in cognitive processing speed and mental flexibility were shown in seniors who consumed just 1.5 ounces of walnuts daily for 8 weeks. According to a new study published in the Journal of Nutrition, walnuts' distinctive polyphenolic compounds may impede the development of neurodegenerative diseases like Alzheimer's and dementia by penetrating the blood-brain barrier and directly combating inflammation in neural tissues. What many don't know is that walnuts also contain melatonin, and melatonin levels typically drop with age, which can lead to sleep problems for many seniors. Some people find that eating a handful of walnuts before bed helps them get a better night's rest. Walnuts' combination of arginine and amino acid that promotes blood vessel function and polyphenols, which lower oxidative stress, also makes them incredibly beneficial to cardiovascular health. In fact, walnuts can enhance the effects of blood pressure medication by helping the elderly keep their arteries flexible. For optimal benefits, keep walnuts in the refrigerator to prevent their delicate oils from going rancid, and try to eat 7 to 9 walnut halves every day. As an added bonus, you can keep your fine motor skills sharp by cracking them yourself whenever you have the chance. Don't be put off by the naturally protective flavor of walnuts. In fact, the slight bitterness is an indication of their potent antioxidants. Second, pistachios. A great way to control your blood pressure. When it comes to the health benefits of nuts for seniors, pistachios may be the most underrated, especially for regulating blood pressure. Pistachios are unique in that they have a low salt content and a high potassium content, around 285 milligrams per serving, which makes them a healthy snack option. This mineral balance is especially important for the elderly because it helps prevent the kidneys from retaining salt as we age. They may lower systolic blood pressure by 3 to 5 points, similar to some prescription medications but without the negative side effects. Additionally, pistachios' lutein and zeaxanthin should be highlighted because these carotenoids protect against age-related macular degeneration, the leading cause of vision loss in individuals over the age of 60, by concentrating in the macula of the eye. Seniors can enjoy the delightful crunch of pistachios without worrying about the potential damage they could do to their teeth and gums from other harder nuts. In addition to being aesthetically pleasing, the presence of antioxidants in their distinctive green and purple hues helps neutralize free radicals, which accelerate the aging process throughout the body. Pistachios are great for elders because of their practicality, preventing overeating and offering a mindful eating experience that can be calming and stimulating for cognitive function. The act of shelling them naturally slows down consumption. The International Journal of Obesity reported that the visible empty shells help seniors better control their intake by providing a visual cue of consumption. If you suffer from arthritis in your hands, you can still enjoy the benefits of shelling pistachios by looking for ones that are partially open. Aim for approximately 49 pistachios per day, or roughly 1 ounce of unsalted or lightly salted pistachios. For the 25% of Americans over the age of 65 who are diabetic or pre-diabetic, the 3 grams of fiber per ounce of pistachios is very helpful in regulating blood sugar levels. First place, Brazil nuts, a remedy for thyroid issues. We ranked Brazil nuts first because they support thyroid function, an important but sometimes overlooked aspect of healthy aging. With 96 micrograms or 137% of your daily requirement in just one nut, these extraordinary nuts are the richest selenium food source known. This is extremely important because many cases of thyroid diseases go untreated, as symptoms are often mistaken for natural aging. Thyroid disorders affect up to 20% of individuals over 65. Selenium abundant in Brazil nuts is crucial for the activation of thyroid hormone, which in turn supports energy production, metabolism, and mood control. In addition to supporting the thyroid, the specific fatty acids found in Brazil, nuts aid in the preservation of myelin, the protective sheath around nerve cells that often declines with age. Seniors may be able to maintain their reflexes, reaction times, and cognitive processing speeds thanks to this myelin maintenance. The selenium in Brazil nuts is particularly beneficial because it is organically bonded, making it more accessible and easier for your body to use than synthetic selenium supplements. Brazil nuts are so potent that you only need a few to feel their effects, and their rich, creamy texture makes even a small amount enjoyable. In fact, I advise seniors to consume no more than 1 or 2 Brazil nuts daily due to the potential negative effects of excessive selenium intake. When you shop for Brazil nuts, try to get ones that are still in their shells. This natural packaging helps preserve the nutrients for a longer period. To prevent them from spoiling due to their high-fat content, store them in the refrigerator. Brazil nuts have a combination of fiber and natural oils that help maintain bowel regularity, making them an added advantage for seniors who experience constipation. Many elderly individuals find comfort in less nutritious snacks, but these are a great alternative thanks to their naturally sweet and buttery flavor. The most astonishing recent evidence suggests that certain antioxidants found in Brazil nuts may slow the natural shortening of telomeres, the caps on chromosomes that typically shrink with age, and thus influence cellular aging. If you're 65 or older, these nuts are perfect for you. In this next section, we will discuss nuts that some seniors may want to avoid or consume with caution. Inflammatory trigger number 4, peanuts. Despite their widespread consumption, peanuts are problematic for many elderly individuals due to the risks they pose. To begin, you should know that peanuts aren't actually nuts at all. They're legumes that grow underground. This makes them susceptible to mold and aflatoxins, mycotoxins, that certain molds naturally produce and can harm the liver and increase the risk of cancer if consumed frequently. As we age, our body's detoxification mechanisms inevitably become less efficient, meaning this risk increases. Even more concerning for the elderly is that peanuts contain proteins that can trigger inflammatory reactions in some individuals, even without a true allergy. Aging individuals are already at a higher risk for joint discomfort, cardiovascular stress, and cognitive decline, and this low-grade inflammation can worsen all three. Most Americans already consume an excessive amount of omega-6 fatty acids compared to anti-inflammatory omega-3s, and the high omega-6 concentration in peanuts contributes to this imbalance. Many doctors fail to warn their elderly patients about the potentially fatal interaction between peanuts and blood thinners like warfarin due to the vitamin K content in peanuts. The addition of hydrogenated oils, extra sodium, and sugars in commercial peanut butters further exacerbates these problems for aging cardiovascular systems. The 63% of American seniors who suffer from hypertension already have enough to worry about. Even natural peanut butter without added salt can increase blood pressure. Peanuts can go rancid and produce harmful free radicals if not stored properly, which is another concern. The common practice of dry roasting peanuts for commercial use also produces acrylamide, a chemical with potential cognitive degrading effects. This is particularly worrisome for individuals already concerned about memory loss. Even if you've been eating peanuts regularly without any noticeable side effects, switching to one of our recommended nuts, even for just 3 days a week, can help you get the nutrients you need while reducing your exposure to these harmful substances. Third, cashews, the sugar increase that's not immediately apparent. Due to their relatively high carbohydrate content and glycemic impact, cashews pose a particular risk to elders. Cashews have less fiber and fewer protective compounds, but significantly more carbohydrates, approximately 9 grams per ounce compared to true tree nuts. Around 25% of individuals over 65 have diabetes, and another 48% have prediabetes, making the blood sugar response from cashews potentially harmful. This is especially concerning because cashews have a generally positive health reputation. So many elderly people consume them in excess without considering their impact on blood sugar levels. The smooth and curved shape of cashews presents a choking hazard that shouldn't be ignored, especially for individuals with swallowing difficulties. They are also among the most commonly aspirated nuts by seniors. Nutritionally, cashews aren't ideal because they contain a high amount of oxalates, chemicals that can bind to calcium in the gut and reduce calcium absorption, a significant issue for elderly individuals already at risk of osteoporosis. For those with an increased risk of developing kidney stones, this danger escalates dramatically after age 60 due to these same oxalates. There's also a less obvious problem with cashew processing. Cashews lose much of their nutritional value during the extensive processing required to remove urushiol, a toxic chemical also found in poison ivy. Many store-bought varieties are oil-roasted and heavily salted, adding unhealthy fats and sodium that can worsen blood pressure and strain on the heart. Cashews contain enzyme inhibitors, which can hinder protein digestion. This is particularly problematic for seniors who often have difficulty digesting food and absorbing protein. Many people are unaware that the creamy texture of cashews can contribute to weight gain during a life stage when maintaining a healthy weight becomes increasingly challenging. Regularly substitute walnuts or almonds for cashews for a healthier snack that poses fewer risks to aging bodies while providing superior nutritional benefits. 2. Macadamia nuts, a result of their extremely high calorie density, pose a significant health risk to the elderly, despite their delicious flavor. They are the most calorie-dense nut available with about 200 calories per ounce. The fact that metabolic rates naturally decline with age further complicates the already challenging task of weight management for the elderly. Their extraordinarily high fat content, about 22 grams per ounce, can exacerbate the already diminished efficiency of the gallbladder. Macadamias can trigger painful episodes that might otherwise go unnoticed by the 15% of seniors with asymptomatic gallstones. Beyond their calorie content, macadamia nuts have one of the highest saturated fat contents among nuts, about 3 grams per ounce, which can raise LDL cholesterol levels, a concern for many elderly individuals. Due to their density and hardness, they pose a significant threat to the oral health of seniors with crowns, bridges, or weakened teeth. This is particularly problematic for those over 65 when enamel weakens due to wear and reduced calcium absorption. Practically speaking, macadamia nuts are among the most expensive nuts, which might lead seniors on a budget to choose cheaper varieties that are more likely to be rancid or improperly stored exposing them to more harmful oxidized lipids. The nutritional profile of commercially available macadamia nuts is already poor, and oil roasting and excessive salting add more sodium and damage fats. Their rich, buttery flavor can lead to overeating, especially for older adults who may have less refined palates and prefer bolder tastes. It's concerning that many elderly individuals eat macadamia nuts thinking they're benefiting their hearts, but research showing the heart-healthy benefits of nuts has largely ignored or downplayed the role of high-fat nuts, like macadamia. Pistachios have a significantly superior nutritional profile that is particularly well-suited for aging bodies. So if you've been regularly enjoying macadamia nuts, you might want to consider switching to them. The first nuts from the pine tree. Pine nuts, a known medication disruptor, are among the most problematic nuts for the elderly for several reasons, particularly relevant to this demographic. The fact that they contain compounds that interact with over 60% of the prescriptions commonly given to seniors is highly concerning, as it means the effectiveness of these medications could be reduced or harmful side effects could be introduced. Many prescription drugs are known to interact with each other, but this is especially true with statins, some antidepressants, and blood pressure medications prescribed to individuals over 65. Most doctors and pharmacists do not inform their patients about the risk of food-drug interactions, which is a significant red flag. Pine nut syndrome is the most worrisome, as it causes pine nuts to impart a bitter metallic taste that can last for weeks after consumption. While this might seem minor, it can have a devastating impact on older adults due to the correlation between taste alterations and decreased appetite and nutritional status. Research indicates a substantial reduction in body weight in as many as 42% of those affected. The syndrome appears to be more common in the elderly, possibly due to changes in taste receptors and detoxification pathways that occur with aging. Pine nuts contain a high amount of polyunsaturated fats, which can quickly oxidize and form inflammatory compounds. This can be a concern for elderly individuals already dealing with inflammatory conditions like arthritis. Their small size and smooth texture can also lead to aspiration, particularly worrisome for older adults who have difficulty swallowing or who take medications that cause dry mouth a problem for over 70% of seniors on multiple prescriptions. While the body's ability to absorb proteins naturally decreases with age, enzyme inhibitors in pine nuts can further hinder protein digestion during this time. Pine nuts are also calorie-dense, which can contribute to weight management issues common after 65 due to their high oil content, even when combined in pesto, their most common culinary use. Alarmingly, new research suggests that compounds in some types of pine nuts may potentially accelerate age-related macular degeneration, the leading cause of vision loss in the elderly. After the age of 65, it's best to steer clear of these four nuts. A person's health, vitality, and brain function in their later years can be profoundly influenced by their dietary choices regarding which nuts to eat and which to avoid. Finally, remember that consistently making small adjustments yields significant results in the long run. Now it's your turn to speak up. Have you noticed any impact on your health from dietary changes such as adding or removing specific nuts? Tell us which nut has had the most significant effect on your life. Share your thoughts and stories in the comments section. We value your input. Valuable lesson. Be mindful of the foods you consume, especially as you age. What you might perceive as healthy could inadvertently be doing harm. Educate yourself on the nutritional profiles and potential risks of common foods to make informed choices that support your long-term well-being. Small changes in your diet can lead to significant improvements in your health over time. Please leave your comments below and subscribe to our channel for more health-related content. On a scale of 1 to 10, how informative did you find this video?